there, Mr. Glassbones. How are you doing today?
I'm good.
Based off of the stuff in your interview, I'm just going to kind of take a few measurements and some range of motion and other things to kind of get a baseline of where you're at. Is that all right with you?
It is.
And can I just confirm your name and date of birth?
My name is Gary Glassbones, and my birthday is November 7th, 1987.
Awesome. And what's your pain level today, Mr. Glassbones?
About an 8 out of 10.
About an 8? All right. So if it's all right with you, we'll go ahead and we'll start taking those measurements.
Okay.
All right. The first thing that I'm going to do is just put this fancy little belt around your waist just for safety.
Okay.
All right, just go ahead and put your arms up in the air.
Okay.
And you can put it back down. I feel okay?
Yes.
Okay. It's involved. It's a tricky little process sometimes. Okay. So the first thing I'm going to do is take your blood pressure.
Okay.
You can just relax. (102 over 60). So I have a little bit of a questionnaire about your pain. I just need you to fill out before we get started.
Okay.
Alright. We're going to go ahead and do a dermatome test. This is just an example. This is me touching you. This is me not touching you. We're going to go ahead and do a practice run on your arm, and I want you to close your eyes, and I want you to say yes when I'm touching you and no when I'm not, okay?
Okay. Yes. No. Yes. No.
Alright, we're going to do the same thing on your back and your lower legs, okay?
Okay.
Alright, ready?
Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes.
We're just going to pretend the flesh-colored pants are his skin.
Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes. No.
Okay. Alright, I'm just going to kind of feel around back by your scar to see how you're doing, okay?
Okay.
Does that hurt?
No.
How about that?
No.
And how about that?
Yes.
Right there? Okay. Let's see. Alright, go ahead and face this way.
Okay.
Alright, go ahead and face this wall. And go ahead and face me. Okay, thank you. Alright, and go ahead and face that wall one more time. And I am just going to measure your scapula here. Okay. Forward a little bit.
One of the kids.
Alright, perfect. Thank you so much. And back up. Let's try this one. Go ahead and bend forward. Okay, stop. I'm gonna stop when you feel this good. Okay. A little bit, nothing. I want you to let me move you this time, okay? Can we try that again? Ready? Go. Okay. Now I want you to go ahead and move it up by yourself. And back down. And go ahead and put your head.
Got a lot of mass in my legs.
Okay, go ahead and move up by yourself. say go, I want you to just turn your whole body to the right and to the left, okay?
Okay.
Ready? Go. And back. Back to center.
Oh, sorry.
It's okay. And then the other way. Your whole body. And back to center. Okay, thank you. Okay, I want you to go ahead and try to lift your chest off the mat.
Okay.
Good. And back down and try to put your hands behind your head and do that same motion. Awesome. I need you to go ahead and cross your arms over your chest, and I want you to try to do a sit-up. Okay, good. And back down. Now I want you to put your hands behind your head and try that same motion one more time. Okay, back down. See how my body mechanics? Okay. Okay. There it is. Does it hurt?
No.
Okay. There it is. Okay. And so mobility. So what we're gonna do is roll you to the side, and then we're gonna sit up, and then we're gonna stand up, okay? And I want you to help me as much as you can.
Okay.
All right, so the first thing we're gonna do is roll, and your torso is gonna be facing me, all right? Ready? 1, 2, 3. Good. And then I wanna go ahead and I want you to help me as much as you can, all right? And we're gonna sit up. 1, 2, 3. Good, good, good. All right, good. Next thing we're gonna do is stand up, and I'm gonna be here in case you need me, all right? Ready? 1, 2, 3. Good. Awesome.
Okay.
Hold. Good. Good. One move you. Good. Back down. Other leg. Good. Awesome. Go ahead and flip over. Don't let me move you in. Okay? Go ahead and put your head down. Good. Don't let me move you out. Good. Don't let me move you out. Good. Don't let me move you in. Good. Okay, go ahead and turn around. Alright, good. Okay.
Yeah.
And I know that another thing you said you were having a hard time was another thing you were having a hard time with was getting up from a chair and also sitting back down to use the bathroom. Is that right?
Yes.
So we're just gonna simulate what that's like. So I'm just gonna watch you get up, and then we're just gonna sit down in this chair. All right? All right. And I'm gonna be here to help you, but I want you to kind of just get up how you normally would. All right? Ready? Go. Okay. Awesome. Kind of in the interview portion, you said that you had trouble getting dressed in the morning. Is that right?
I do.
So I kind of want to watch to see what that looks like so we can make goals around getting that better. Is that okay? All right, can you go ahead and just put the shirt on for me? And can you give me a pain rating? Is it about the same?
It's about 8 out of 10.
Okay. Okay. All right, thank you. Go ahead and sit back down. All right, thank you. Go ahead and just work on your gait to kind of work on your endurance. So we're just gonna do one lap around the couch, okay? Go. You can try. And hold on to things. you. You okay?
Yeah.
Okay. Thank you. Thank you. Okay. Great. Hey there, Mr. Glassbones. Thank you so much for coming back to therapy. How are you feeling today?
Feeling better?
You a little bit better after our last treatment?
Yeah.
So based off the stuff that you told me last visit, I went ahead and made a plan of care for you off of the goals that you talked about, getting dressed and kind of getting up and down from the chair, and I implemented those and we made some exercises to kind of help facilitate that. Is that alright if we carry those out with you?
Yes, thank you.
Can I just get your name and your date of birth one more time?
My name is Gary Glassbones, and my birthday is November 7th, 1987.
Awesome, alright, thank you. So I just kind of want to go over our goals for therapy here. So we're going to kind of work together. I'm going to be your coach, but you're going to be an active part of this where we're going to work together, give you some exercises, and get you better. Is that all right with you?
It is.
I just kind of wanted to go over a few things from your doctor. They did send over the protocol, and you're not to lift anything over 10 pounds for 3 months. And the surgeon did say that the active movements of your back are okay, so I'm just going to check a couple of those today, if that's all right with you.
It is.
And as far as your incision goes, if you, I know you can't see on your back there, but if your wife notices any color changes or any swelling or anything like that that looks like it's getting away from where it's going now, then we need to just keep an eye on that, all right?
Okay.
All right. What is 110/58. Okay, try to work on putting on these clothes again. So when you get dressed, I think it would help a little bit if we did it while we were sitting down. I want you to go ahead and take the pants in your hand, roll them up, and then stick your leg through it, and then do the same thing on the other side. And then once you're ready to pull them up, then go ahead and stand up and see if that's a little bit better for you, okay?
Okay.
All right, let's go ahead and sit down. All right. Ready to stand up? A little bit easier that time?
Yes.
Awesome. So the next thing that we're going to do is just kind of work on transferring to kind of get you able to sit up a little bit better, walk a little bit better, and then squat down a little bit better, okay? So when you're getting up, what I want you to do is scoot all the way to the edge of the chair. So you can go ahead and do that with me. And that way, it's going to be a little bit easier for you to get up that way. When we're getting up, I want you to do some kind of rocking to get your momentum going. And I'll help you do it, but on the count of 3, we're going to go ahead and stand all the way up, okay? Ready? 1, 2, 3. Good job. All right, and then we're just going to go ahead and kind of walk over to the chair. What I want you to do when you sit down is back up until you can feel the back of the chair. Do you feel it?
Yes.
I want you to go ahead, and if you need to, you can reach back with that other hand, or that hand, that's fine, and go ahead and sit down. And that way you kind of know where you're going and you can use your body to guide you, okay? All right. So the next thing we're going to do are just some gentle muscle setting exercises. So I just want you to do a slight contraction of your quads and of your glutes, okay? Ready? Go. Hold 1, 2, 3, and let go. One more time. 1, 2, 3, and let go. Good, thank you. These are just some ankle pumps, so I want you to go ahead and point this toe towards your head, and then point it towards the wall, and then this toe towards your head. I want you to go ahead and point it towards the wall, and then these two toes both towards your head, and then both towards the wall. Awesome, thank you. I just want you to practice, and you're just gonna slide your left heel back to about here, and then back down. And then you're gonna do the same thing on the right, and then you're gonna go back down, and then you're gonna do both your legs at once, and then back down. Okay. Alright, the next thing we're gonna do are just some short arc quads. So all I want you to do is your heel should kind of be on the ground right now, because we're not straightening all the way, and I want you to go ahead and straighten your leg all the way, and then put it back down. And one more time. And back down. Good, and then we're gonna do that on the other leg. Sneak that in there, and then same thing, go ahead and just straighten your leg all the way, and back down. One more time, and back down.